But we are going to begin at 4 o'clock with a stark new snapshot of the COVID surge in New York. Hello, everyone. I'm David Usher.
I'm Natalie Pasquarella. Hospitalizations have now crossed at a threshold we hope we'd never see again. Take a look. More than 10,000 COVID patients are in hospitals across the state of New York. That number has soared by more than 1,600 in just 2 days. The state also reporting 99 new deaths.
In the city, all public schools are open after the holiday break. PS 58 in Brooklyn reopened today after officials there broke protocol and did go remote for a day because of a staffing shortage. All this as New York City's mayor is calling for businesses to get people back in the office faster. News 4's Chris Glorioso covering this today. He is in Lower Manhattan. Chris?
Over the last couple of days, the mayor has repeatedly said schools are the best place for kids. And over the last couple of days, he has started to urge big investment firms to bring their workers back into offices. Pre-pandemic, here on Wall Street, this hour, people would be flooding to support local restaurants and bars. But as of today, almost every major investment bank still has employees working remotely. At Bravo Pizza in the financial district, the tables are empty. David, the manager, says business is down more than 80% because so many office towers are still more than 80% empty. On this block of Trinity Place, more storefronts are closed than open.
Every store that's been in this block has been here over 20 years in business, and they're all out.
Aware of the devastating impact of empty skyscrapers, Mayor Eric Adams took to the airwaves Tuesday, urging banks and other businesses to order workers back to offices because their employees help pay service workers paychecks.
We have almost 1 million people who are behind in their rents right here in this city. We have low-skilled employees who can't do remote employment from home or telecommuting. That's not a reality in a city like New York and across America. I need my cities to open.
But the mayor's call for a return to in-person office work comes at one of the most challenging points in the pandemic. The winter Omicron surge is not yet dissipating. Infections still going up, with more than 1,750 new hospitalizations and just 887 patients discharged. Hospitals in New York are now admitting nearly twice as many patients as are going home. But the illness is less lethal. Statewide, 99 patients died yesterday, compared with a 2021 peak of 202 deaths last January. Fewer people may be dying of COVID, but the pandemic is still putting small businesses under. Back at Bravo Pizza, they are doubtful they will survive to serve slices another year.
There's no future right now. We're dying over here. We're dying. And I'm the last guy to get into the cemetery. My other guys, my neighbors, they're buried already. I speak to them still. They're out.
The winter COVID surge still keeping so much of the city's private workforce at home and also continuing to have a major impact on the public workforce. As of today, 30% of emergency medical service workers are absent. About 25% of sanitation workers. Other city agencies have absences in the double digits as well. Omicron is not done with us yet for now. Reporting live on Wall Street, Chris Glorioso, News 4 New York.
All right, Chris, thank you. We want to go to New Jersey now, where that COVID surge putting major strain, we've been telling you this week, on hospitals there. That is forcing some to get creative and quickly expand capacity. There are now more than 5,000 COVID patients hospitalized across the state. The number went up by more than 400 in a single day for the second straight day. And it is rapidly approaching the pandemic peak that we saw almost 2 years ago. Let's get out once again to News 4's Brian Thompson this week, live in Freehold today. Hi, Brian.
Yeah, Natalie, and I got to tell you, they are certainly feeling the strain at hospitals from Central State here in Freehold to Hackensack to RWJ, University, Holy Name, you name it. 71 hospitals in this state, and they're all feeling the pinch and the pain from this latest surge. And I can tell you right now, they are looking very hard at the lessons learned from the battle scars of the first go-around.
New Jersey hospitals are filling up fast. The number of COVID patients has climbed by more than 400 each of the past 2 days. That's more than double from a week and a half ago and threatens to surpass the worst of the early days of the pandemic. At Central State and Freehold, Chief Operating Officer Tom Scott.
We're looking at every square inch of space that we have available. You know, we're taking other office space that we were able to relocate people out of, being able to put that into use.
For Central State, that means this office space space will likely be converted to beds in a matter of days, and overflow ER rooms will instead be converted to overnight rooms as well. This all goes back to the post-holiday crush of testing, showing positivity rates nearing the worst of the pandemic. Ocean County expanding its testing this week, as so many others are, though results are taking longer and longer to get back. More and more hospitals are going on Divert, the state dashboard showing 14 at one point last night. That's 20% of the state's ERs telling ambulances, go someplace else. And hospital staff are getting sick as well. University Hospital in Newark, 400 sick at one point or another during the entire month of December. Now in 2022.
Now, just in the first 4 days of January, we have just over 100. So this is getting really critical.
University also planning for critical staffing levels where a critical care nurse no longer directly cares for 2 or 3 patients. Instead,
so you would have the ICU nurse supervising nurses who normally do other things, taking care of critical patients.
Holy Name in Teaneck says its staffing is holding up, but it's bracing for the surge by aggressively planning on expanding bed space. I'm also told everyone on a ventilator is unvaccinated. The story of one patient in his 30s from a few months ago especially poignant.
The day he was put on a ventilator was the day his wife gave birth to their first child. And prior to being intubated, his words to the ICU staff were, "The minute I get out of here, I will get vaccinated."
He didn't get out of there. He passed away at Holy Name, despite their best efforts. I did talk, as you saw, to Dr. Elna Hall at University Hospital. He tells me he has not had one fully vaccinated patient die on him. Not one. Live in Freehold, Brian Thompson, News 4 New York.